Treating hypertension with diuretics. Various types of diuretics are used to treat hypertension, such as amiloride, spironolactone. These are potassium sparing diuretics. Then we have chlorothiazide, metolazone, and hydrochlorothiazide. These are thiazide and thiazide-like agents. And then we have furosemide, that is a category of loop diuretics. On this slide, we will be discussing the nursing considerations for the potassium sparing diuretics. First of all is renal insufficiency. Potassium sparing diuretics are not recommended to the clients who has renal insufficiency or who also has a raised level of potassium, which is hyperkalemia, because both these conditions may cause life-threatening levels, rise in the levels of potassium. So that's why potassium sparing diuretics are not recommended in these two conditions. CBC. These diuretics may cause agranulocytosis, which is too low of the white blood cells to fight infection. So nursing should be advising the client to report fever or any other signs of infection. Pregnancy category. Potassium sparing diuretics are pregnancy category B to D. So that means these agents are not recommended to a client who is pregnant and also to the pregnant lactating mothers. Gynecomastia and testicular atrophy. These drugs, potassium sparing diuretics, they cause breast enlargement and testicular atrophy. So we need to be watching the clients for that. Diet changes. Instruct the client to avoid foods. Those are high in potassium, such as patient need to avoid sweet potatoes. Patient needs to avoid bananas, kidney beans. Next, we will be learning about the nursing considerations in the thiazide and thiazide-like diuretics. First, we have hypokalemia. These agents, they increase the excretion of potassium and causes hypokalemia. These agents act like the effect of the electrolyte levels. They also alter the blood chemistry. So we should be monitoring closely the complete blood count, should be monitoring the electrolytes levels. We should be monitoring blood urea nitrogen and cholesterol levels closely. Effect on the drugs. Thiazide and thiazide-like drugs, diuretics, they decrease the effect of anticoagulant drugs and also decrease the effect of insulin and anti-diabetic agents, which may cause hyperglycemia, raised blood glucose levels. So we should be monitoring the client for these effects closely. SLE, thiazide and thiazide-like diuretics may worsen the symptoms of SLE, which is systemic lupus erythematosus. So that is why these drugs are contraindicated in SLE. Digoxin, loss of potassium and loss of magnesium caused by the thiazide diuretics may increase the risk of digoxin toxicity. Ginkgo biloba, instruct the client to avoid taking herbal supplements such as ginkgo biloba while taking the thiazide diuretics, because this may cause a paradoxical increase in blood pressure. So that is why I advise your client not to take these kind of supplements when taking thiazide and thiazide-like diuretics. Loop diuretics. Number one is toxicity. Diuretics may cause phototoxicity. in the clients who has poor renal function. However, hearing reverses once we discontinue the medications. Hypotension. Diuretics cause dehydration and also they decrease the blood volume, circulating blood volume. So, orthostatic hypertension may occur. Nursing should monitor the client closely for, for the complaints of dizziness, for faintness, and also advise the client not to rise too quickly or to from a sitting or a laying position because it may trigger orthostatic hypotension. Daily weight. Monitoring the lab values and daily weights are essential. Nursing to inform the physician if any change is noted in both. Intake and output. Close monitoring of intake and output is required because um, there is a risk of dehydration and also there it can be risk of fluid retention. Monitor the client for any kind of leg edema, lower legs edema, ankle edema, and also auscultate the breath sounds and heart sounds, and and also monitor the vital signs closely. Photosensitivity and lithium toxicity. When a drug is absorbed into the bloodstream, it enters the skin, and photosensitization occurs. Sunlight is also absorbed through the skin, and which causes chemical changes in the compound, which causes a reaction in the body. Diuretics can decrease the excretion of lithium, which may cause a lithium toxicity. So that's all about the use of diuretics to treat the hypertension. I hope that helps. Thank you.